Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the anal triangle. Let's try and use this image by the side to illustrate where the anal triangle is positioned. This is the configuration of the pelvic cavity. And we know that the pelvic cavity is limited inferiorly by the pelvic floor or the pelvic diaphragm. This is what is highlighted here in purple. While inferior to the pelvic floor, the pelvic diaphragm is where we have a space that is referred to as the perineum. This perineum is further subdivided into two triangular spaces. So this demarcation is created using this alignment here that is highlighted in dotted blue. At the anterior side here, we have the anteriorly placed urogenital triangle. I've put up a lecture on the urogenital triangle. If you've not checked that lecture off, please kindly go and do so. While posteriorly behind here is where we have the anal triangle. It's a triangular space that is located behind this demarcation that is highlighted here in dotted blue. And this is what this lecture will be focusing on. So write down with me as I highlight the basic configuration of the anal triangle, the different structures that form the boundary of the anal triangle, and also the structures that are located within the space. Triangle can also be referred to as the posterior perineal triangle, which means that the posteriorly positioned triangle that is located within the perineum. We try to use this image by the side. We say we have the pelvic cavity that is inferiorly limited by the pelvic floor or the pelvic diaphragm. Inferior to this pelvic floor, the pelvic diaphragm, we have the perineum. And this is the perineum here carved out in this space. The perineum, we say, is further subdivided into two using this alignment here that is created in dotted black. And this alignment is what further subdivides the perineum into the two triangular spaces that it is made up of. This alignment is seen to run from one ischial tuberosity to the other. So anterior to this demarcation, we have the anteriorly placed urogenital triangle, and this is what is highlighted here in green, while posteriorly behind, we have the posteriorly placed anal triangle. We try to use this image by the side to further illustrate this. This is where we have the perineum in female. We said that the perineum is a space that is located inferior to the pelvic floor or the pelvic diaphragm. And this is where we have the pelvic floor or the pelvic diaphragm, arrowed here in black. The pelvic floor, the pelvic diaphragm is seen to form the inferior limit of the pelvic cavity. And this is what is seen in this image. So inferior to this structure is where we have the perineum. And if you drive further, you see that this perineum, which is a diamond-shaped configuration that is located inferior to the pelvic floor, the pelvic diaphragm, is divided into two triangles. And you know that the diamond-shaped outline can be further subdivided into two triangular spaces because we know that through an imaginary line running from one lateral end to the other. So due to the diamond-shaped outline that the perineum presents, this is why it is able to be divided into two triangular spaces, considering the fact that this imaginary line will run from one lateral angle to the other. So if you try to create this alignment as shown here in this image, and you use this imaginary line here that is demarcated in dotted black to further subdivide the perineum. So you see that this alignment is running from one ischial tuberosity on the right to another ischial tuberosity on the left. And of course, this alignment is seen to run medially across the perineal body. This is where we have the perineal body at the central part, seen as a point of muscular collection at this central region. So you see this alignment running through these three sub-regions as presented here in this image. So in the anterior part, you have the anterior urogenital triangle, and posteriorly, you have the posterior anal triangle. So this is how the anal triangle is carved out from this perineal space. Now let's drive through to the borders of the anal triangle. Now we know that the anal triangle is a triangular space, which means that it is a three-sided region. So if you try to use this image up here to represent the triangular configuration of the anal triangle, you see that the apex here is directed posteriorly, while the base is facing anteriorly. So you see that the apex of the anal triangle is directed posteriorly, and this is as a result of the configuration that it presents around the posterior region of the perineum. So this apex, using this lower image, It is formed by the tip of the coccyx. This is where we have the tip of the coccyx arrow there at this point, and this is what forms the alignment of the apex of the anal triangle. While the base, we say, is facing anteriorly, and the base is what is seen to be arrowed here in red. The base of the anal triangle is formed by the imaginary line that runs from one ischial tuberosity to the other, of course, running through the perineal body. So you see this alignment created at this point. This also tally with the posterior border of the perineal membrane. The perineal membrane is a membrane that is limited to just the anteriorly placed urogenital triangle. As a matter of fact, the perineal membrane is the inferior fascia of the urogenital diaphragm that is also limited to the anteriorly placed urogenital triangle. So you have this membrane here at this point, and the posterior border of this membrane is also seen to align with the base of the anal triangle. We also have the lateral borders. Remember, we said that it is a three-sided configuration. So on both lateral sides, we have the sacrotuberous ligament here highlighted in white. We have two. We have one on this side, and we have another one on the other side. The sacrotuberous ligament, just from here breaking down the name, as I've always said on this channel, is a ligament that is seen to run from the tuberosity of the ischium to the sacrum. So you see it running from the tuberosity of the ischium here, and it's being directed finally where to be inserting on the lateral wall or lateral border of the sacrum. So this is the sacrotuberous ligament here highlighted in white, and this is seen to form the lateral borders of the anal triangle. Then also we have the roof. The roof of the anal triangle is formed by the pelvic floor or the pelvic diaphragm. And this is what is seen to be arrowed there at this point. So this is what forms the roof of the anal triangle. Of course, it is deep, and this is what is presented in this image. Remember when we tried to describe the perineum, we said that the perineum is located inferior to the pelvic floor or the pelvic diaphragm, while posteriorly in the perineum is where we have the anal triangle. So we should expect that the roof of the anal triangle will be formed by the inferior border or limit of the pelvic floor or the pelvic diaphragm. And this is what is arrowed here at this point. While the floor will be formed by the skin and also the fascia seen to run deep to it. So let's go through the content. What are the structures that are contained within the anal triangle? Within the anal triangle, we have visceral. So we have a number of organs located within this space. We have fossae. We have two fossae. We have one on the right side and one on the left side of the anal triangle. We'll be dwelling more on this as we go through with this lecture. We also have muscles. We have a number of muscles located within the anal triangle, and we'll be highlighting this. Then we have ligaments. Then finally, we have the neurovascular structures. These are all the structures that are contained within the anal triangle. And for the subsequent slide, we'll be taking each of these one after the other, also establishing how they run and are being positioned within the anal triangle. So first on the visceral that we have within the anal triangle is a corresponding named organ, which is the anal canal. So you have the anal canal, the central part of the anal triangle. And this anal canal is not just left on its own. It's seen to be guided or surrounded by the external anal sphincter. So if you try to use this image by the side there, this is where we say we have the anal triangle at the posterior part of the perineum. And this is where we have the anal canal. The anal canal is located at the central part of the anal triangle. And this anal canal, we say, is seen to be guided by the external anal sphincter, which of course is the sphincter that is seen to surround the anal canal. This external anal sphincter is a voluntary sphincter, and is seen to help guide and control the opening and closing of the anal canal. Remember, we also have the internal anal sphincter that is located more on the superior part. So the external anal sphincter is located more on the inferior part, and this is why it is seen to form alignment or be positioned within the anal triangle. If you try to extract this central structure, of course, which is structurally seen to contain the anal canal and its surrounding external anal sphincter, if you try to extract this is the kind of configuration that I'll be seeing down here. So at this inferior part, at the central part, you have the anal canal. This is the lumen of the anal canal. Then surrounding the anal canal on the outside, we have the internal anal sphincter. And this is what is arrowed here in blue. This internal anal sphincter is different from the external anal sphincter because it is an involuntary muscle. We do not have control over this muscle. And besides that, the internal anal sphincter is also seen to be limited to the superior two-thirds of the anal canal. if you look at this internal anal sphincter, you see that it is not extending to the inferior part. Where we have the external anal sphincter on the outside, it is seen in 3 subsets, and this is what is harrowed here at this point. If you look at the external anal sphincter, you see that the external anal sphincter is located or positioned surrounding the anal canal, but it is seen at its inferior two-third. So you see the internal anal sphincter at the superior two-third, while you see the external anal sphincter surrounding the anal canal at its inferior two-third. And this is why the external anal sphincter is seen to be positioned within the anal triangle. So you see that the external anal sphincter is in 3 subsets. So you have a segment that is a subcutaneous zone, of course, a subset of the external anal sphincter. And this is located at the most inferior part here that is close to the skin. And this is why it is referred to as the subcutaneous. So after the skin or below the skin. Then after this, you have the superficial subset of the external anal sphincter. Then finally, you have the deep subset of the external anal sphincter. So these 3 collections are taken as the external anal sphincter. And you see it surrounding the anal canal at its inferior two-third. And this is why it is being positioned within the anal triangle. So at the central part of the central region of the anal triangle, you have the centrally placed anal canal, of course, that is guided or covered on the outside by the external anal sphincter. So it's good for us to be able to establish why we have these 2 structures located within the anal triangle, and of course are positioned at the central parts. The next structure that we have is the fossae, which are referred to as the ischioanal fossa or the ischiorectal fossa. So these 2 fossae are spaces that are located on the lateral side of the anal triangle. So if you try to use this image here, we already carved out this space, and this is the region where we have the anal canal and also its surrounding external anal sphincter. On both lateral side here that is harrowed at this point, you see a potential space created. And this potential space is filled with fat and also connective tissue. And this is what is highlighted here in white. So this space is not just left open, it is seen to be filled with parts of fat and also connective tissue. And what they do in this regard is to support the expansion of the anal canal during defecation. This will help to prevent the prolapse of the anal canal, that is, preventing it from moving out of space and also helping to protect it during the process of expansion so as to prevent it from damage. So you see that you have cushioning effect around the anal canal created by the fat and also the connective tissue contained within the ischioanal fossae. We also have a number of muscles located within the anal triangle. The first muscle that would be highlighting is the levator ani muscle, and this is the levator ani muscle here, harrowed in green. You know that the levator ani muscle forms the bulk of the structural component of the pelvic floor. I've also put up a lecture on the pelvic floor. If you've not checked that lecture, please kindly go and do so. The levator ani muscle is the major structural component of the pelvic floor. If you try to use this image by the side here, this is where we have the levator ani muscle here, arrowed in green. You see that this muscle is seen within the anal triangle. This muscle is also seen to extend into the anteriorly placed urogenital triangle. But because we are focusing on the anal triangle, it is taken as one of its structural components. The next muscle that we have within the anal triangle is the coccygeus muscle. And this is what is seen to be harrowed here at this region. You see the coccygeus muscle is located at the posterior region of the pelvic floor. Going back to our lecture on the pelvic floor, the pelvic diaphragm, we stated in that lecture that the pelvic floor is structurally made up of the levator ani muscle and also the coccygeus muscle. The coccygeus muscle is seen at the posterior region of the pelvic floor or the pelvic diaphragm. And at this posterior end here is where we have the coccygeus muscle. The next muscle is the obliterator internus. This is the obliterator internus here, harrowed in red at this lateral edge, one on this side and the other one on the other side. The next muscle that we'll see is the gluteus maximus. This is the gluteus maximus here, harrowed at this posterior end. The gluteus maximus is seen to form the posterior limit of the anal triangle. Then we also have the anococcygeal body or the anococcygeal raphe, and this is what is seen to be harrowed here in white. The anococcygeal body is a fibrous tissue that is seen to extend from the anal canal to the coccyx. And this is why it is so named the anacoccygeal body. And you see it connecting these two structures along the midline plane. And this is what is seen to be harrowed at this point. So these are the structural components of the anal triangle. And we've tried to illustrate where they are specifically located within the anal triangle. The next structure that we have within the anal triangles are ligaments. Basically, we have two ligaments. So if you try to create this alignment here, using this line that is demarcated in black, we see that the anteriorly placed triangle is the urogenital triangle, while behind we have the anal triangle. So within the anal triangle posteriorly, we have the sacrospinous ligament. The sacrospinous ligament, as I've always said on this channel, is for us to break down the name. It is a ligament that is seen to run from the spinous process of the ischium to be inserted on the lateral border of the sacrum. And this is what is seen to be harrowed at this point. You see it originating from the spinous process of the ischium on this end and directed where it is finally inserted on the lateral border of the sacrum. We also have the sacrotuberous ligament. This is the sacrotuberous ligament here, harrowed in gray. The sacrotuberous ligament, all we still need to do is to break down the name, is a ligament that is seen to extend from the tuberosity of the ischium. And you see the fibers are directed also finally inserting on the lateral border of the sacrum. And this is what is seen to be presented here in this image. So you have these two ligaments also contained within the anal triangle. Then the last set of structures are the neurovascular structures. So we have a number of vessels and also nerves also located within the anal triangle. If you look at the anal triangle at this posterior end, on the lateral side of the anal triangle, we have a canal that is referred to as the Alcus canal or the pudendal canal. And this is what is highlighted here in blue. This Alcus canal or the pudendal canal is so referred to as the pudendal canal because it's seen to accommodate the pudendal vessels and also the pudendal nerve. And that is why it is so referred to as the pudendal canal. So this Alcus or pudendal canal is what is seen to be highlighted here in blue. It is located around the lateral region of the anal triangle. Within the Alcus on the pudendal canal, we have the internal pudendal artery and the internal pudendal vein. And this is what is seen to be highlighted here in red and also in blue. The internal pudendal artery is a branch from the internal iliac artery. So after its emergence from the internal iliac artery, it is seen to be directed into the Alcus canal, which is located within the anal triangle. And this is why it is so taken as the structures that are contained within this space. We also have the pudendal nerve. This is the pudendal nerve here, highlighted here in green. The pudendal nerve is one of the branches from the sacral plexus. And after its emergence from the sacral plexus, you see this pudendal nerve is also directed into this Alcus canal or the pudendal canal. And this is why they are so contained within this space. We also have branches emerging from these vessels and also nerve. We also have a number of branches emerging from the internal pudendal artery and also the pudendal nerve. So let's look at clinical anatomy. So we'll talk about hemorrhoids or pile. Hemorrhoids are swollen blood vessels that are seen within the anal canal or around the anus. And of course, this is as a result of an overstretched vein that will become thin and also become irritated. And this can result from straining during the process of defecation. This could also occur when there is increased abdominal pressure, also in pregnancy and also vaginal birth. So thanks for watching this video.